Okay, so this video we are going to be looking at the motor and cerebellar functions. We have assessed the symmetry and size of all the muscle groups in the previous videos. So we've assessed the gait of my patient, which was normal. We've also assessed the balance of the patient with the patient walking, tandem walk, and she was balanced. What we're going to do now is assess the balance using the Romberg test. So what we're going to have the patient do is we're going to have the patient stand up for me. Okay, stand up. Both arms are at each side, and feet are together. Your feet are together. And we're going to note any unsteadiness or swaying. There's no swaying with my patient. Okay. Can you close your eyes for me? So you ask your patient to close their eyes for about 20 seconds and note if there's any imbalance or swaying. So the normal finding should be the client stands erect with minimal swaying. I mean, there can be some swaying, but it should be minimal. And you check that with the eyes both closed and open. A positive Romberg test, it means there's swaying, moving the feet apart, swaying and moving feet apart to prevent fall is seen with disease of the posterior column and vestibular dysfunction or cerebellar disorder. So my patient did not have that, so the finding was normal for the Romberg, was negative for the Romberg test. The next thing that we're going to do is we're going to do the finger to nose test. And basically we're going to have the patient with the eyes open first. Put one arm out to the side, and then the other one is going to touch the nose. And repeat with the other arm, like do it with the other one. Okay, then we're going to repeat it again, but with the eyes closed. So close your eyes. Do it again with the other one. Okay, perfect, thank you. What we want is the client to be able to touch the finger to the nose with smooth and accurate movement and with little hesitation. Uncoordinated, jerky movements or inability to touch the nose may be seen as cerebellar disease. The next thing that we're going to do is the rapid alternative movement. And the rapid alternative movement, we're going to have the client sit down. Can you sit down for me? And we're going to have the client touch each finger to the thumb and increase the speed. So we're going to go like this. Okay. So do it faster and faster. Okay, and do it with the other one. Start out slow. And then do it faster and faster. Keep going. Okay, perfect. You can stop. So we want the client to be able to touch each finger to the thumb rapidly. And for some older clients, the rapid alternating movements are difficult because of decreased reaction and flexibility. Now we are going to do the heel to shin test. And my patient is sitting down, and I don't have a bed here. So the way this is performed, you have the client lie down in the supine position, and to the side of the heel of the right foot, ask the client to lie down, and to the side of the heel of the right foot down the left shin. Repeat the same on the other heel. So basically we would have, the client's leg would be straight like this, and then this leg you would want the client to pass the heel all the way up the other leg, like this. So you'd have the client move the heel like that, and you repeat it on the other side. Can you try to do it for me without lying down? So you have the client move the heel, perfect, and then do the same thing on the other leg. Do the same thing on the other leg. Okay, so that is the heel to shin test, and you want the client to be able to run each heel smoothly on each side of the shin. Deviation of the heel to one side or the other may be seen as cerebellar disease. All right. So that concludes the motor and cerebellar function assessment. What we're going to do now is the sensory assessment. The first thing what we're going to do is assess light touch with a cotton ball. So I have a cotton ball here, and I'm going to what I'm going to do is we're going to have the client close both eyes, and as I'm moving the object over the client's body, we're going to ask the client if they feel it and where it's at. Okay. All right, so close your eyes for me. Can you tell me where you feel the movement?
Right here.
Okay. Keep your eyes closed. Can you tell me where you felt it?
Yes, right here.
Okay. So my client was able to feel the cotton ball on her left arm, so that she passed the light touched. The next thing is we're gonna assess pain. So to assess pain, we are going to use a blunt or sharp object such as a pen or a paper clip, and we are going to pass it or poke the patient with it. So I'm going to use this stick here. Close your eyes for me. Can you tell me where you feel it?
Yes, right here.
Okay. One more time.
Okay, that's right here.
Okay, perfect. So my client can feel pain. The next item that we're going to look at is, well, this I'm going to describe since I do not have the tuning fork. Okay, so this tests the vibratory sensation. What you would do is strike a low-pitched tuning fork on the heel of your hand and hold the base of the distal radius, fingertipped, medial malleolus, and the tip of the great toe. So we're going to hold the tuning fork along these location, and then we're going to ask the client to indicate what he or she feels, and then we're going to repeat it on both sides. Okay, and what we want is for the client to be able to identify each sensation at the correct location. If they're